So I applied to St. John's because I was looking for a community hospital setting where we would be the only residency at that hospital, and you got to have all the experiences that you could in family medicine, and you wouldn't get elbowed out of the way, so to speak, by other residents on other services. You really got to kind of run the whole hospital and really get that in-depth experience.
Pretty much from day one, I was treated like a member of the family. I was greeted warmly by the medical assistants here, and I got to know everyone really well. I really gelled with the faculty members, and they really kind of took me under their wing.
One thing I really like about St. John's is the way our curriculum is structured, and so we have a lot of longitudinal experiences. You have your own clinic, which provides great variety. You have call, which during call nights you're taking care of admits from the ED, you're taking care of house pages on the floor, you're taking care of OB triages, you're taking care of newborn stuff, and so all those areas of care are kind of interweaved across the curriculum. It's not you're on one block and then you're on the next and you forget what you learned on the last. You get that repetition where you never really have your skills get rusty.
What's unique about our program is when we're on call, we're really the physician that's running the hospital. You are suddenly the person making decisions in the hospital, and there's always someone watching over you, and you have your senior at first to really guide you through, but as you go throughout the year, that kind of the hand that they're holding throughout the course of the year, they start to let go even more and more and more. I think the way that St. John's does that is that it prepares you to be a very well-rounded physician that is able to practice full spectrum, and kind of going back to why I chose this program. I was seeing the third years where they were at when they were graduating, and I was thinking to myself, these residents in their third year seem so competent and so confident in their abilities. Like, that's exactly what I want.
I met an 80-year-old woman in the emergency department that came in for high blood pressure, and so she didn't have a doctor at that time, so I gave her a business card, and she ended up following up with me in clinic. And it's really cool to go from meeting each other, not knowing each other in the emergency department, to now she comes to clinic, and she's my longest tenured patient, and I like to say that she was my first patient, and I tell her that too. And it's just, I think you always have that special connection of your first patient.
I have loved my first 9 months that I've spent here with the program, and I've really developed some great relationships with faculty, other residents, the staff here at the clinic, and most of all, getting to know a great patient population as well, both in the clinic and the hospital. It's been super fun.